Cold emergencies are something that are frequent much more in the winter months and further north than maybe here in Alabama, but it is something that we do need to consider no matter where we're responding. When we look at some sort of predisposing factors or things that make people more susceptible to heat or cold emergencies, we want to look at their age because the very young typically have a much larger surface area, so they have a whole lot more skin than they do volume, so they can gain and lose heat much easier than an average adult. And then as we age, we lose some of the ability to regulate. So our blood vessels don't constrict and dilate. We don't have the goose pimples or goosebumps, or we don't have the hair standing up. So they can't regulate their temperature as well. The very young also cannot shiver very well and may not have a whole lot of body fat on them as kind of insulation. And the same goes true for our elderly patients too. They may not have the body fat and may not be able to shiver as well. In addition to that, we want to look at like activity level. So were they very active, running around, playing a sport? Were they doing something, or were they just sitting there? Typically when they're just sitting there, they're more likely to lose heat than gain heat, so they're more susceptible to hypothermia. We also need to look at how well they're protected as far as their clothing and shelter. So were they in a somewhat sheltered location? Were they in a house, outside of a house? What sort of clothing do they have on? Do they have on a coat, hat, mittens? All those things that we use to help stay warm. If you're thinking about heat, were they dressed appropriately with like maybe tank top, shorts, or were they overdressed for the environment and ended up gaining too much heat? There are some predisposing medical conditions, and a lot of these will also kind of go hand in hand with whether they have good circulation or not. So someone like with diabetes may not be able to control their temperature as well as someone without diabetes, so they're more susceptible to hypothermia and hyperthermia, but we tend to think more hypothermia. Someone with a neurological condition, but then also patients that have like thyroid issues, patients that we have that are going into trauma or into shock. We know that they can lose heat as they lose blood. So these are all things to think of when dealing with hypothermia and hyperthermia. In addition, we want to be looking at just how long they were in the cold or hot environment, and there's a condition called urban hypothermia or urban even hyperthermia, where we take someone usually older, and because they're worried about finances, a lot of times will not run the air conditioner or run the heater as much as maybe they should, and because they cannot sense things as well, their body just doesn't sense hypothermia or hyperthermia as well. There's a very gradual increase or decrease in temperature, and so this is a concern with our elderly patients and neighbors that we should be checking on them. We also want to look at any sort of medications that they may be on. I know things like pain medications and anti-anxiety stuff. Even some of the antihistamines can cause a patient to become a little less susceptible to, or a little less, they don't feel that they're losing their temperature, losing their heat like they're supposed to. So they're more susceptible to hypothermia, less susceptible to noticing it and doing something about it. So they're more likely to become a little hypothermic. We also know that alcohol, narcotics can cause somebody to lose heat and may not even realize that they're doing that. And obviously this all then is also dependent on how hot or how cold it is outside. So if the temperature is not that far off from our normal body temperature, we're probably not gaining or losing a lot of heat. But if it's very cold or very hot, very humid, very dry, all things to consider when determining how bad or how quickly someone may have suffered from hypothermia or hyperthermia.